Villgro Africa is an organization that started in the year 2015 as a replication effort of Villgro Innovation Foundation model, which was piloted or which started in India in the year 2001. So we went there to learn about their model and expanded that here. Our focus at Villgro Africa is healthcare, purely healthcare focus. We try to solve Africa's toughest healthcare challenges by trying to bring accessibility of healthcare at the same time as affordability, especially to the masses, the bottom of the pyramid.
Back to the 2013-2015 period, there were no entities like Villgro Africa. Those who were focused on health and locally indigenous. And so they were incubators here and there, accelerators. A lot of them were foreign, I would call them quote unquote foreign entities that were running incubators here. So the need for having a locally grown institutional incubator focused on health was really paramount.
The turning point was especially when we were now in a position to start deploying capital to these startups, because then the word went out that, hey, these guys are actually serious. They're actually funding us. They're actually providing support and opening doors for us. And to me, the way I look at it is kind of like we've always, in my head, I've always thought we've snowballed. We started off in a very small way, but very methodically keeping at it, and you kind of snowball into a bigger snowball in terms of reputation, in terms of credibility, in terms of trust.
One thing that's sort of special about Villgro is that we are a demonstration. We were a startup. I think we're no longer a startup, but we started with nothing. And it was an idea. Yes, we had a kickstart from Villgro India, but it didn't come with immediate funding. It was an idea to explore how to expand into Africa back in 2014. And that has since grown and developed to a broad range of partners and a strong team that we're super proud of, that are committed to helping people improve health access and healthcare on the continent.
I think it's really the magic of having people who understand the business perspective, but also understand the kind of unique needs of a health enterprise. It's not the same. It requires a lot more patience. And so the ability for them to know, for Villgro Africa to know how to support local innovators to navigate that space and know where to push them and where not to, I think has been a critical part of why they've been successful.
Since the partnership started with Villgro Africa, we've been able to achieve a lot as a startup and as a company, and also as innovators and entrepreneurs. One of the things that we've been able to achieve is in terms of growth, in terms of how we view our business, how we manage our aspirations for the future, how we've done business modeling, how we've done financial modeling, has all been at the support and courtesy of Villgro Africa.
One major thing that we appreciate with Villgro is that they helped us access funds for research, and so we conducted a formal research on a topic we care so deeply about, which is kidney disease. And as a startup, it's very hard to actually conduct a formal study, and this really helped us to get the results that we wanted. And now we are going to pilot the first mobile dialysis truck in Africa thanks to this study. So it's been amazing.
So going forward, I'm excited about how Villgro Africa is positioning itself as a leader in the healthcare innovation space. And if you check some of the programs that we are running, like the Health Tech Hub Africa, we are growing in scale and influence, and I can see us playing a critical role in shaping the future of health tech in the African continent. And honestly, it's really inspiring to be part of this transformative journey.
In concluding, I would like to say that we are open to collaborating with others. It needs 10 other similar organizations to create the impact we're looking at in the continent. We are happy to share our learnings, to work with partners in other countries, to make sure that this can be replicated, that the impact can be reached at scale. There's no impact until it's widespread, at scale, and also irreversible, so that impact becomes now the new norm. So happy to see who we can work with to really make lives better for the African continent in terms of access to healthcare.